Yes, Dr. Art Reingold has been alongside with us, and he's an infectious disease specialist. And Dr. Reingold, I wanted to ask you about what's happening right now as we watch all of these passengers disembark the ship. We know at this point that they most likely are Canadian citizens that will be catching a plane from Oakland International. But I mean, Alan had mentioned earlier, they're pretty tightly packed there. Is there any special protocol that you feel they should be following at this point that they're not?
Well, if I understood correctly, they're all wearing masks. It's a little hard to see from this distance, but to the, I would think that that would be useful in terms of ensuring that if somebody does cough or sneeze, that they're not likely to infect someone standing in line next to them. So I think that's an appropriate precaution.
And being out in the open air, not in a confined space, that has to help somewhat too.
We do think that transmission is less likely out in the open than indoors, so that's also true, yes.
What can you tell us about coronavirus? If a person was to come down with coronavirus, is it a lot like the flu? What are the symptoms like?
So first of all, there's a wide range, and many people, in fact, the majority of people are probably either minimally symptomatic or have no symptoms at all. And it's only a certain proportion of the people who get infected who are going to get pretty sick. But the standard answer to your question is the hallmarks of this infection are fever, sore throat, cough, upper respiratory symptoms that are hard to distinguish from the flu. Not so much runny nose, things like that, but particularly fever and cough.
And we tell people, you advise people, we're being told, don't touch your face, keep your hands away from it. Just now, it's so hard to do. It's hard.
I just saw you touch your face.
Exactly.
Alan just did
it. It's habit. I just do it, and I noticed a lot of people I talked to said, I never paid attention to it before. I was told not to do it.
Well, there are studies that, watching people and filming them, that the average person touches his or her face dozens of times a day. So it's a totally human thing to do. If you itch, you might want to scratch. If you want to adjust your glasses the way I have to sometimes, it's just a natural thing to put your hands to your face. So it does take some discipline to do that less often or to not do it at all.
And Dr. Reingold, I wanted to ask you about what goes on board these cruise ships, because this isn't the first time we're seeing a disease spread. This is the coronavirus. Before that, it was the norovirus. Why is this happening, and what can be done in the future to ensure that we don't continue to see this?
Well, you're right. We have a lot of experience with outbreaks of norovirus, diarrhea, vomiting, gastroenteritis on cruise ships. There are occasionally other types of outbreaks. There have been outbreaks of Legionnaire's disease, for example, on cruise ships. But fundamentally, the problem with norovirus and this virus is that it's readily transmissible from one person to another, potentially through also inanimate objects in the environment. And so, when you have large numbers of people confined in a relatively small space, interacting with each other a lot, there are just a lot of opportunities for infectious agents to be transmitted. And it's very hard to maintain social distancing. It's very hard to prevent transmission from one person to another. But clearly, the maximal one can do in terms of environmental sanitation is important. And of course, having people try and use good hand washing and other techniques is also part of it.
Because, I know there are critics of the cruise industry that call them floating petri dishes. But in their defense, I think the cruise ship companies have come a long way, and they've done a lot more to disinfect. And the last thing they want is for something like this to circulate through a ship or ships that they operate. They don't want that. That's terrible for business and for people.
Well, it's not only bad for business, but it's bad for the customers. It's bad for the crew. Obviously, it's in their best interest to keep customers and crew healthy throughout a cruise. So I'm sure they do an immense amount compared to what they might have done 10, 15 years ago.
Do we need to do more?
Yeah.
Social interaction is going to happen.
Well, I'm not sure. I have to admit I've never taken a cruise, so I don't know exactly what they're currently doing, but I suspect if you had a cruise expert here, they might be able to point to a few areas where they could up their game a little bit, but I work on the assumption they're doing a pretty good job at the moment.
Well, it's funny because we've spoken to a number of passengers who at this point say that they're ready to go on a cruise again, and that this whole situation has not deterred them from booking their next cruise. So It's kind of amazing that you kind of look at this and it's just a tiny kind of blip on their screen and it doesn't mean a whole lot. It kind of also begs the question. We're watching this unfold, and it is just a massive undertaking. Do you think that this is an overreaction? Do you think that this is an appropriate reaction?
So I think given what happened on the cruise ship off Japan, this is an appropriate reaction. This virus can clearly make people very sick, and unfortunately, particularly older people may even die as a result. So we clearly want to prevent additional transmission and protect people whenever we have that opportunity. Now, people who argue, well, we don't do this much to prevent influenza, which kills a lot of people every year, I actually think that's not a particularly helpful comparison. I think people are a little blasé about flu because they sort of lump it together with the common cold. Mm-hmm. The flu is a serious illness, and we want to prevent people from getting the flu because many people do die of the flu. But just because people get really sick and die from the flu doesn't mean we want to let people get really sick and die of something else. Right. If we can prevent that.
Good point. Right. Now, from politicians and scientists and researchers such as yourself, experts, we've heard various estimates of when we might see a vaccine for this novel coronavirus. What's your take in terms of when we might see it, how effective it can be? Should we jump the gun and bring something out right away?
So in the old days, when we were trying to develop and test and license a vaccine, that process often took 10 to 15 years. It was slow. There were a lot of reasons for that. And so the fact that we've now, through modern biology, been able to speed that up remarkably is terrific. But the fact is that even with all that modern biology, the idea that we could have a vaccine we know is safe and effective in less than 18 months would be pretty astonishing, and I personally doubt that that's going to happen.
Wow, really?
So I think, and Tony Fauci of NIH has said this, there seem to be a few political leaders who are a little confused on the subject, but we will not have a vaccine for at least 12 to 18 months.
Well, even Fauci said, that's what he said, is a year at the soonest, but I see at least a year and a half.
Well, and I think, as many people in the audience will know, we live in a context in which not everyone trusts vaccines and vaccine manufacturers. So although we always work really hard to make sure the vaccines we give people are safe, I think in this instance it's all the more important that we assure the safety of a new coronavirus vaccine. And that just takes time and research to make sure of that before we start giving it to potentially tens or hundreds of millions of people.
So eventually, when we get a flu shot, will it include this particular strain, or would it be something separate? I think a lot of people would line up to get that vaccine.
Well, so you raise a good point about combination vaccines. So, for example, we put measles, mumps, rubella together into one shot. I have not heard anyone talk about combining this vaccine with flu vaccine, so I'm pretty sure it's going to be separate. And then I think the really interesting question is who should get this vaccine. Infants, children, adults, the elderly, people going on a cruise. I mean, exactly who the target population should be, I think is going to lead to some really interesting discussions.
And Dr. Reingold, as we continue to watch these live pictures of a lot of these Canadian citizens being taken off the ship, earlier we saw a couple of passengers removed from the ship, either passengers or crew member who looked critically ill. They were loaded onto stretchers and then taken away in an ambulance. What happens next for these patients? What is the procedure once they arrive at the hospital?
So it seems to me there could be two types of critically ill people, those who have coronavirus as the cause of their illness and those who have some other illness, but who still potentially could have the virus. And clearly the doctors, the healthcare providers taking care of them will have to sort out exactly what their health problems are and treat them appropriately. But
how do you treat coronavirus for the patients that are arriving?
So first of all, they need to be treated in strict isolation to make sure they don't infect healthcare workers. So the healthcare workers need to be appropriately in protective equipment. We don't want them infecting other hospital staff. We don't want them infecting other patients or visitors. So they're in isolation. And we're pretty good at that in the hospital setting when people are trained and have the right equipment. But then beyond isolating them, their care will involve making sure they're getting enough oxygen. So if their lungs aren't working well enough, they might be put on a respirator, for example, if they're really, really, really sick. Other supportive care in terms of fluids and blood pressure and things like that are pretty routine. I think the real unknown is whether we're going to have any antiviral drugs that can improve the outcomes in these patients. And there are at least 2 or 3 clinical trials of drugs going on right now, mostly in China. But we won't have results from those for at least another few weeks or a couple of months.
One of those involved the Gilead drug,
yes,
right?
Gilead is
Foster City.
Gilead
company.
and Foster City, definitely one of their drugs is undergoing a randomized trial right now.
We know that some of those patients have been taken to local hospitals. Do you feel like the hospitals are ready for this? The hospitals in our area.
I'm pretty comfortable that they wouldn't have taken these patients to a hospital that isn't prepared in terms of isolation. And we know how to do that for infections spread through droplets. So I'm pretty comfortable that people have thought clearly about which hospitals should have these patients and that they have the capacity to take care of them. I don't have any doubts about that.
Well, what we're watching here is a slow, very deliberate process of getting passengers, Canadian citizens coming off first. These have to be the ones who are asymptomatic or tested negative for the coronavirus, but they're going through this process of coming down the ramp. They're then being divided amongst those 3 portable tents. Camera being blocked by the chopper there for a second, but the portable tents, and then slowly, one by one, they're being dispatched to those 3 different buses. We don't know what the divisional characteristics are for which bus they get on and where they're going to be going, but we're told that the Canadian citizens will be going to the Oakland airport, the north part of the airport, for a chartered flight out. Other citizens, not Californians, will be going up to Travis to be quarantined for 14 days. So, and again, we haven't started talking about the other international passengers on here as well. And as we have told you, the crew members, most of them will stay on board and go back out to sea.
Now, earlier, the Canadian consulate reached out to its citizens, sent out an email with an itinerary detailing what they would be experiencing today, and they were saying that the disembarkation would happen sometimes around 3 o'clock, and it's what we're actually witnessing right now. By 5:30, those buses are to be deporting to Oakland Airport, and this process has been slow going, so I'm going to imagine that they're not quite running on time, but not too far off schedule. Around 7 o'clock, they should be boarding airplanes, and at 9, that is when their scheduled departure from Oakland Airport should occur, and then they're going to be arriving tomorrow morning around 5:15 to Trenton. So there are almost 300 Canadian passengers on board this ship, so the process is going to take some time.
Dr. Reingold, I wanted to ask you again, because as most people, as you said, even if they are positive, they have coronavirus, they're not going to show serious symptoms, most people. Should they just, at what point do they contact their health provider, or do they contact the county department of health and say, I think I have it, or could they just possibly treat themselves for having a cold or the flu?
So are we talking about the people getting off this ship?
No, we're talking about the general public.
In general?
Yeah.
Okay. So I think this is obviously an evolving situation. If someone is ill and is worried that they might have the coronavirus, even once the test is widely available, you'll have to have a healthcare provider order that test. You can't just walk into a drugstore and say, test me for coronavirus.
Take the test. Okay.
Right.
All
It's
right.
got to be ordered by a healthcare provider the way any other diagnostic test is. And so I would say for someone in that situation, calling your provider first.
Give them a heads up.
And if there's some particular place they want you to go when you come in, put on a mask. We don't want you sitting in the waiting room, potentially infecting other patients or infecting unsuspecting nurses and healthcare workers.
All right,
Very good,
Dr.
Reingold.
Reingold.
Thanks so much.
We appreciate it. Thank you so much.